my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back, and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Relapse from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours, I got my voice.
Hello. Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live with Preetham Panja, and today we are before treatment live, and today date is 11th of October 2022. He is having a kind of voice problem, and in the future we are going to be post treatment live, so please subscribe our YouTube channel and don't forget to watch his post treatment live. नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर, और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 11 अक्टूबर 2022 और हमारे साथ हैं प्रीतम पांजा और ये हावड़ा से हैं, वेस्ट बंगाल से हैं और इनको कुछ वॉइस की समस्या है और भविष्य में हम लोग ट्रीटमेंट के बाद भी इनके साथ लाइव होंगे। तो आप हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए और बेल आइकन को प्रेस कर लीजिए ताकि जब भी हम लाइव हों तो आप इनकी जो चेंजेस हुई हैं वॉइस में ऑनलाइन ट्रीटमेंट के माध्यम से जो भविष्य में होंगी उसको आप अच्छे से देख पाएँ। और इस लाइव में हम किन किन बिंदुओं पे चर्चा करने वाले हैं उसके बारे में मैं एक रफ आइडिया दे देता हूं, तो आप लोग जुड़े रहिए। पहले होगा इंट्रोडक्शन अबाउट मी, आवर सेंटर एंड आवर यूट्यूब चैनल। नेक्स्ट मैं सुनाऊंगा प्रीतम पांजा की वॉइस, क्या इनकी वॉइस की समस्या उसके बारे में आप सुनेंगे और फिर मैं बात करूंगा। नेक्स्ट जो हमारा टॉपिक होगा वो होगा स्पीच थेरेपी स्टार्ट करने से पहले किन बातों का ध्यान रखना चाहिए, इस पे हम लोग चर्चा करेंगे। फिर होगा कई बार सोशल मीडिया में कई बार हेल्थ केयर क्वैक्स वगैरह भी स्पीच थेरेपी देने की बात करते हैं, तो उसके बारे में भी मैं बताऊंगा कि स्पीच इन हियरिंग टेक्नीशियन क्या होते हैं और स्पीच लैंग्वेज पैथोलॉजिस्ट एंड ऑडियोलॉजिस्ट क्या होते हैं और DHLS का फुल फॉर्म क्या होता है। तो ये इस पर भी हम लोग चर्चा करेंगे और इस बात पर भी चर्चा करेंगे कि अगर किसी व्यक्ति के पास मात्र RCI नंबर है तो वो क्या स्पीच थेरेपिस्ट कहला सकता है, इस पर भी हम चर्चा करेंगे। और काइंड ऑफ सर्विस वी प्रोवाइड, हमारे क्लिनिक में किन चीज़ों के सर्विसेज अवेलेबल हैं इस पर चर्चा होगी। एंड विल टॉक अबाउट द हाई पिच वॉइस साइन सिम्टम कॉज एंड ट्रीटमेंट, विल टॉक अबाउट द स्पीच प्रोडक्शन मैकेनिज्म and we'll be also talking about is there any side effect of voice therapy, how to contact us. I'll be talking about accommodation facilities at our center. Next we'll be talking about do we have any branch of our center. Next will be cost, duration of treatment. Then I'll be giving certain tips to keep your voice healthy, and I'll talk about the vocal abuse as well. And I'll be talking about how do we treat international patient online or offline. Is saying 1, 2, 3 in new voice or saying in new voice is the end of the treatment while correcting the pitch problem. And is voice therapy result is permanent, or is there any relapse after our services, especially in case of high pitch voice and puberphonia, and effects of food and drink on voice? So these are the topics we are going to cover. So let's start one by one. So introduction about myself. My name is Sanjay Kumar, and by profession I'm a speech language pathologist. So you can say SLP Sanjay Kumar. SLP means speech language pathologist, and I have studied from AIIMS Delhi. I did my Bachelor of Science Honours in Speech and Hearing from All Indian Institute of Medical Science, New Delhi. And I did my Master of Science in Speech Language Pathology from University of Mysore. So I treat communication disorder, and my area of expertise is more in voice disorder. So our center is more famous in treating voice disorder. And our center name is Sanjay Speech, Hearing and Rehabilitation Center, and that is situated in Bangalore. And at our center, you can reach from Bangalore International Airport within 30 minutes by drive, and you can also reach from the Bangalore railway station or bus stop, main Majestic bus stop, within 30 minutes. And our location is also mentioned at our website, Reach Me. Once you click our website and Reach Me, you will find the location where it is situated. So this is a small introduction about me, our center, and our YouTube channel. And our YouTube channel was started in the year 2010. And from 2010, we are creating awareness about the communication disorder and its non-surgical management. तो हमारा YouTube चैनल 2010 में स्टार्ट किया था हमने, और तब से हम लोग नॉन सर्जिकल, बिना सर्जरी के द्वारा जो कम्युनिकेशन डिसऑर्डर की मैनेजमेंट है उसके बारे में अवेयरनेस पूरी दुनिया में क्रिएट कर रहे हैं. और इनफैक्ट आप सबों के प्यार की वजह से एंड हमारे YouTube चैनल के सब्सक्राइबर मोर देन 17,000 हैं. ऑफ कोर्स हमारा जो काम है वो बहुत ही रेयर है, क्योंकि रेयर कम्युनिकेशन डिसऑर्डर, उसके बावजूद भी इतना प्यार हमें मिला. तो थैंक यू फॉर योर लव एंड सपोर्ट एवरीवन. और नेक्स्ट था हमारा अब नेक्स्ट है कि आप प्रीतम पांजा की वॉइस को सुनेंगे. तो प्रीतम पांजा, टेल अस व्हाट एग्जैक्टली प्रॉब्लम यू आर फेसिंग, व्हाई यू कॉन्टेक्टेड अस. अनम्यूट योर माइक, वी आर लाइव एट आवर यूट्यूब चैनल.
हाय, माय नेम इज प्रीतम पांजा. प्यूबर्टी के टाइम से ही मेरा पतले आवाज आते थे. कभी किसी से बात करते समय फोन पे बहुत दिक्कत आता है, और यही सब होता है. प्यूबर्टी के टाइम से ही मेरा ये समस्या है.
थोड़ा इंग्लिश में बताइए, उसके बाद बंगाली में बताइए क्या प्रॉब्लम फेस कर रहे हैं.
Hi, my name is Pritam Paja. I am facing high pitch voice since my puberty, and it is my voice did not change in puberty. So there was a very मुझको बहुत दिक्कत आता था, और बहुत लोगों में जहाँ भी ट्रेन और बस में जाते तो बहुत दिक्कत आता है.
बंगाली में बताइए क्या प्रॉब्लम फेस कर रहे हैं.
আমার পিউবার্টি টাইম থেকেই আমার হচ্ছে পাতলা, মানে একটু মেয়েলি কণ্ঠের মতো শোনাই. তাই জন্যই আমি সঞ্জয় স্যারের সাথে কথা বলি এবং এই সমস্যাটা সমাধান করার জন্য.
ठीक है, अपने माइक को म्यूट कर लीजिए. तो अभी आप लोगों ने इनकी वॉइस को सुना होगा, प्रीतम की वॉइस को, और इनफैक्ट हम लोग ऑनलाइन वॉइस थेरेपी के माध्यम से हेल्प करने की कोशिश करेंगे. और भविष्य में जब हम ट्रीटमेंट के बाद लाइव होंगे तो आप लोग जरूर देखिए, और इसके लिए आप हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए, बेल आइकन को प्रेस कर दीजिए. नेक्स्ट है, स्पीच थेरेपी स्टार्ट करने से पहले किन बातों के बारे में जानकारी जुटानी चाहिए. So first, before starting speech therapy, especially if you are in India, you try to find out what degree your speech therapist or speech pathologist and audiologist is having, from where he studied, in which year he got the degree, and from which university the college was affiliated, from which medical college or which speech engineering college he got the degree, and in which year he got the registration in RCI, Rehabilitation Council of India. And RCI registration number is not enough to become anyone as a speech pathologist or speech therapist, because RCI registration number, the special educator will be having, and even the speech engineering technician will also be having. So just having RCI number is not the evidence of that somebody is a speech pathologist and audiologist. You have to find what degree they are having, from which year he got the degree, from which university his college was affiliated, and which year he got the RCI registration number. So try to find all the details. and sometimes healthcare quacks will try to confuse you. And there is a one DHLS diploma course in the speech and hearing to produce the speech and hearing technician. So don't get confused with those people. They are a technician to support the speech pathologist and audiologist, but they are not the certified speech pathologist and audiologist. Sometimes technician will also write with their name speech therapist, voice therapist, and audiologist. So just I'm trying to create awareness the difference between technician and speech pathologist and audiologist. At this moment, at this time, to become a speech pathologist or audiologist, you should study. You need to study 4-year bachelor, and then if you want to do the master, 2-year master. So, and the technician training will be 10 months will be the training like academic, and 2 years will be means total will be the 12 months. So 12 month, and the professional will be having bachelor degree in 4 years, and then master, if they are having master degree, 2 years again. So they will be having 6 years of training, but technicians will not be having. So sometimes innocent people get confused with the technician, thinking that technicians are a speech pathologist and audiologist, and they will present themselves sometime in the social media. So you should know that. And then they will be telling, okay, the speech pathologist and audiologist will be charging more and we are charging less. So something you should know that the difference. And मुझे एक बड़ी अच्छी कहानी याद आ रही है, ठीक है। मैं कहीं पे सोशल मीडिया में पढ़ा था, इंटरेस्टिंग बात बता रहा हूँ। एक शिप था और शिप में कुछ टेक्निकल प्रॉब्लम हो गई, तो शिप को ठीक करने के लिए बहुत सारे लोग, many people came to correct that, and people were not able to handle that situation. Then there was a very old person, and he was expert in that area. And once he came and he put one place some hammer, and the ship started working. And then he sent his fees. It was a huge amount. Then somebody asked, why your just for one hammer this much cost? He told, no, my hammer cost is very less. The other are just to having the experience to where to put that hammer. तो कई बार टेक्नीशियन लोग कंपेयर करने लगते हैं स्पीच पैथोलॉजिस्ट और ऑडियोलॉजिस्ट से। तो ये सब जानकारी रहना चाहिए कि दोनों की ट्रेनिंग में डिफरेंट होता है और आप किससे सर्विस ले रहे हैं। और इनफैक्ट आरसीआई जो है, रिहेबिलिटेशन काउंसिल ऑफ इंडिया, विल नॉट बी गिविंग लाइसेंस लाइक टेक्नीशियन टू राइट द विद देयर नेम स्पीच पैथोलॉजिस्ट एंड ऑडियोलॉजिस्ट। नेक्स्ट था कि क्या मात्र आरसीआई नंबर होने से कोई स्पीच थेरेपिस्ट कहलाने लगता है? तो बिल्कुल नहीं कहलाता है। दे शुड हैव द degree in speech pathology and audiology, and kind of services we provide. To understand what kind of services we provide, you can explore our YouTube channel playlist, and then you will be getting more ideas about our services. So once you explore our YouTube channel playlist, you'll find different kind of playlist, and that will be having pre and post videos also. For example, you will find vocal cord paralysis playlist, you'll find Puberphonia high pitch voice playlist, you'll find Stammering playlist, you'll find spasmodic dysphonia, phonatory gap, sulcus vocalis, misarticulation, aphasia. So once you'll explore our YouTube channel playlist, you'll get an idea how a certified speech pathologist changes the life of people having communication disorder. And because I'm an audiologist as well, so we'll be also finding, we do hearing testing and we dispense hearing aid. So you'll find playlist for the patient whose hearing testing was done and he was suitable for hearing aid machine, and once we fitted hearing aid, how the communication improved. So that videos also will be able to find. And next was high pitch voice signs, symptom, cause and treatment. So if a boy age is more than 14 years and he's still talking in a childish voice, or on the phone when he's talking, people are saying ma'am, so this can be a symptom of high pitch voice. And high pitch voice can occur in case of sulcus vocalis also. The nature has not given the sufficient mass and the length of the vocal cord. We have seen in phonatory gap also the high pitch voice. So understanding of the problem is very, very important. Sometimes when the hormonal issues are there, testosterone hormones is not sufficient, that time also can be high pitch voice, but that is a very rare situation. So understanding of the problem is very, very important, and then only you should start the treatment, and that can be done by a professional, not by the technician. And kind of services we provide: high pitch voice signs, symptom, cause, and the treatment. Yeah, so before understanding the cause of this problem, like high pitch voice, let's let's understand the normal speech production mechanism. So once we understand the normal speech production mechanism, it will be easier for us to understand the abnormal. For normal speech production, first thing is the thoughts that comes in the brain, then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you are saying pa, both the lips will be coming closer together and touching each other. When you want to say the tongue comes between the teeth. When you want to say ka, back up, the tongue elevate and touching the soft palate. So each and every sound has own place, own manner of articulation. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord. Vocal cords move, sounds generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound is own place, own manner of articulation. So it is a little complex process. In this process, hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles will not be there, there will be another communication problem. Of course, you are not having. That will be stammering. When the place of articulation and manner of articulation is not correct, there will be another problem called misarticulation or mispronunciation. उच्चारण दोष जिसको हिंदी में बोलते हैं. और कई बार उच्चारण दोष वाले जो पेशेंट्स होते हैं, they will be having some hearing issues also. So we do the hearing test in some cases when we feel that, and then accordingly we suggest and give the speech therapy. So like speech production is a complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles are not there, there will be fluency issues. So now let's talk about your problem, what the Preetham is having, who is with us during this live. So during puberty, what happened? Mass and the length of the vocal cord increases due to a hormone called testosterone. So if mass and the length of the vocal cord will increase, pitch reduces. You must have seen before puberty, there will be no much difference between boys or girls' voice. But during puberty, because of the testosterone hormone impact, in case of boys, the vocal cord mass increases, length increases, so pitch reduces. So in a very simple way, I can say that if I'm considering, here we have larynx. Inside the larynx, we have two string-like structure known as vocal cord. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar, and sounds generate. So before puberty, there is no much difference between boys and the girls' voice, because their vocal cord are almost same or similar, we can say that. But during puberty, because of the testosterone impact, the vocal cord mass and the length increases in case of boys. And so in a very simple way, if we can say that vocal cord is like a string, guitar's string like a structure. So before puberty, it is a thin string of a guitar like a structure. But after puberty, during puberty, because of the testosterone hormone impact, it's becoming thick string of a guitar like a structure. So thin string of a guitar will produce high pitch voice, and thick string of guitar will produce low pitch voice. Okay, so in case that's why the pitch changes during puberty, like because of the testosterone, in case of boys, the vocal cord become thick, so the pitch will be lower. So why it happens, the problem like what Preetham you are having? So during puberty, your mass and the length of the vocal cord got changed. Now you are I think 19 years. So of course you are in teen age. So at the age of 14-15, your vocal cord mass got increased, length got increased, and it was ready to produce the low pitch voice. But from childhood to puberty, you used your high pitch voice, childish voice. So because of so many years habit, you are not able to switch on to the new voice. So what you did to maintain your childish voice, suppose this is the vocal cord. So now this has become thick because of the testosterone impact in your case. So it is ready to produce the low pitch voice, but because of so many years habit, you are hesitating to use that new voice during your puberty. So to do that, to maintain your childish voice, you did unknowingly, I can say that, maybe some psychological reason also you can say that, but it is in very rare case. What you did, like instead of vibrating the whole mass and the whole length, you vibrated only thin edges of the vocal cord. Okay, so when you started vibrating thin edges of the vocal cord to maintain your childish voice, so vocal cord was thick string, but started behaving like a thin string of a guitar like a structure. So your pitch become higher. So if with a certain vocal exercise, if I'll stimulate your whole mass and the whole length of the vocal cord, the vocal cord which is behaving like a thin string of a guitar like a structure will start behaving like a thick string of a guitar like a structure. So when the guitar string will be the thick, the pitch will be lower. And you can also understand if you are from science background and you have basic knowledge of acoustics. So frequency will depend upon the mass of the vibrating string, length of the vibrating string, and the tension. There is in physics, there is one relation. N is equal to 1 by 2L under root T by M. So frequency is inversely proportional to the mass and the length. So in your case, what is happening? Thin edges of the vocal cords are vibrating. So it means vibrating mass and the vibrating length are less. The pitch is higher. If I stimulate whole mass and the whole length of the vocal cord to vibrate, so what will happen? Vibrating mass will increase, vibrating length will increase. So in this formula, N is equal to 1 by 2L under root T by M. M will increase, L will increase, then N will reduce. So this is the biophysics behind that. Okay. And we'll be giving all the treatment by online method. So next question next topic was, is there any side effect of voice therapy? So if you are doing any vocal exercise under the supervision of a certified speech language pathologist who is expert in treating voice disorder, there is no side effect. But if you are doing self-treatment or taking treatment from the healthcare quacks, so there is always chance of vocal abuse, and vocal abuse may result into the vocal nodule, phonatory gap, muscle tension dysphonia. So always take voice therapy from a certified professional. And the next is how to contact us. So to contact us, there is a very easy method. You can go to the description of any of our video. You'll find our website. You can click the website, then you click the reach me, and you'll find our email ID, contact number, and where is clinic situated on the Google map. And next is the accommodation facilities at our center. So our center is a clinic, it's not a hospital. So we don't have accommodation facilities, but our team will be supporting you to get the accommodation, paying guest or nearby hotels and all. So next is, do we have any branch of our center? So we don't have till now any branch of our center. Our center is in Bangalore only, and our center's name is Sanjay Speech, Hearing and Rehabilitation Center. And next was cost, duration of treatment. So it varies. So before commenting on the cost and duration of treatment, we suggest our patient to please call us. We'll do the perceptual evaluation, and then if we need, we suggest certain tests like a stroboscopy or laryngoscopy, and then we'll be commenting on the cost, duration of treatment. And next is tips to keep your voice healthy. So for that, you drink plenty of water. Water is a very good lubricant. Avoid throat clearing. Like if you're doing very frequently, the friction in the vocal cord will happen, and that is not good for your voice and the vocal cord. Avoid smoking. If you smoke and if you are a regular smoker, there is a chances of developing the vocal cord polyp. And avoid whispering also. Sometimes people will talk like this, my name is Sanjay Kumar, something. So when you are doing whispering, that time also it creates stress on the vocal cord, and that may damage your voice or vocal cord if you do very regularly or for long duration. And cost and tips to keep your voice. Yeah, shouting is a vocal abuse. And as I told, drink plenty of water, and if you are a public speaker, in between you should drink water. And shouting, when the background noise is more, so that time you should avoid to speak, because if you speak, you need to create extra stress on the vocal cord because of the background noise. And if you are a teacher or professional voice user, you have to speak to the big gathering, ask the administration or management to provide the amplification device. जैसे कि अगर टीचर हैं और क्लासरूम बहुत बड़ा है और वहीं से सोचेंगे कि लास्ट बेंच तक आवाज़ पहुंच जाए और जोर से चिल्लाकर पढ़ाएंगी बच्चों को लंबे समय तक, तो vocal nodule डेवलप हो जाता है. तो if vocal nodule is in early stage, we can correct by the voice therapy, but later stage it will be difficult to correct by the voice therapy, and you need to go for surgery. And even after surgery also you have to take voice therapy and vocal hygiene. So take care of voice, those who are especially the professional voice user, and those who are normal people also, you should know that. And how do we treat international patient, online or offline? So both the methods are available for our international patients, and but who will be the online client? Once we do the perceptual evaluation, then we decide. And is saying 1, 2, 3 in new voice or saying in new voice is the end of the treatment. Like during pitch correction, I have seen in the social media so many videos, the patient is talking in a high pitch voice in one video, like in high pitch voice, and next is in the low pitch voice. So this can be a stage of treatment, but it can't be the end of the treatment. I don't know why the people will be just putting those video in the middle of the treatment. And if somebody is saying one in the high pitch voice and next one is the low pitch voice, that is also a stage of treatment. It is not the end of the treatment. End of the treatment means patient should be able to speak everywhere, anywhere in the new voice and at the sentence level. So be careful while getting impressed by those kind of videos. And is voice therapy result is permanent, or is there any relapse after our services? The kind of problem you are having, like Preetham Panja, what you are having, in such cases, once we have treated, the changes are permanent. And to create awareness, during COVID pandemic, we did live with the patient to whom we have treated 5 years back, 6 years back, and their voice were stable. So till now, what I have experienced in this condition, what Preetham Panja is having during this live, once we treated, the voice was stable for lifelong. But I can say that we have done the follow-up, and I expect it will be lifelong only. To get an idea, we did live, and I have given those links also. I think 10-11 patients live we did long back, to whom we have treated many years back. And if you want to watch those videos, so any of our YouTube channels comments, sometimes we write 35 minutes video to watch, and if you go to the description of that videos link, you will be able to find it. So many patients were free during COVID pandemic, and we did that one. And is voice therapy result is permanent, or is there any relapse after treatment? And in some communication disorder like a stammering or a spasmodic dysphonia, we have seen the relapse. And one message I have, those who are watching this, many phonatory gap patients, those who have come to our center, without doing any surgical management, we have seen comparatively better result. And some patient, those who try surgery and once it doesn't work, and then they will be coming. So I have seen not very impressive results. So my suggestion is, first you should try voice therapy, then you should think about the surgical management. Because recently one patient came from the Norway, and we gave 4 days therapy, and he was not changing, and he left the therapy in the middle because the change was not happening. So, and later I came to know, in fact, he was, I don't know, he informed, I was not able to recall, but some of the patients, those who are in the group therapy, they were telling he went for the surgical management first, and then it didn't work. Then he came to our center from some other place. So be careful if you have phonatory gap. First try to go with the voice therapy management based on experience, what I am telling. But of course, you have to decide what method you want, surgical or voice therapy. Effects of food and drink on voice. So of course you should avoid spicy food. If you will take very spicy food, acid will form, or we can say the GRD, gastroesophageal reflux disorder, will develop. And when you will sleep, and that time maybe it will those acids will come near your throat, and that may damage your voice and the vocal cord. So too much spicy food should be avoided. And sleeping time and your dinner time should have at least 1.5 or 2 hours gap, because after immediately dinner you will go to the sleep. The acid which will form during digestion of the food will accumulate near the throat area sometime, and that may damage your voice and the vocal cord, and the problem will be again GRD, gastroesophageal reflux disorder. And if you have such kind of problem, you can also meet to your physician to manage your GRD. So these are the few points I wanted to share, and I want now I'm free, so I'll be checking the questions, and those who have joined this live, I want to say thank you. So Muhammad Mustafa Kamal Raju, thank you for joining, and he's telling, hello sir, I am from Bangladesh. A long time I follow your video, and I want to treatment by you. I face vocal cord problem in my childhood. Now I am 25 years old. So Muhammad Mustafa Kamal Raju, please call us. We'll do the perceptual evaluation, and if needed, we'll suggest certain tests like stroboscopy or laryngoscopy. Then we'll be able to comment on your problem, like what we can help you or we can't help you. Next is Sneaks. Hi sir. Hi, how are you? He's saying Drona here. Hi Drona, how are you? And Dave Genesis saying, sir, I have long laryngitis. How can I contact you? So Dave Genesis, Laryngitis means infection in the larynx, and I'm speech language pathologist. So during that time, I can suggest some vocal hygiene, but infection can't be corrected by the voice therapy. So my suggestion is you can meet to the otolaryngologist or laryngologist to correct the infection. And even after correction of the infection, if the problem persists, please call us, and after perceptual evaluation, we'll guide you better. And Heavy Way is saying hi Heavy Way. अंकित शर्मा सिंह सर थोड़ा हिंदी में बात कर लो, तो बताइए क्या क्वेश्चन है आपका अंकित शर्मा जी. थैंक यू फॉर ज्वाइनिंग एंड वाचिंग. और नेक्स्ट है ईशानी कुमार पासवान. सर आई हैव सम प्रॉब्लम, व्हाट शुड आई डू. तो ईशानी कुमार पासवान आप हमें कॉल कीजिए, हम परसेप्चुअल इवैल्यूएशन करेंगे, फिर आपको हम गाइड कर पाएंगे. और नेक्स्ट है अंकित लोहान के क्वेश्चन. सर आई एम 12 एंड स्टूडेंट्स आई एम स्टैमरिंग. सो अंकित लोहान आप हमें कॉल कीजिए, आपकी आवाज़ को सुनेंगे, समझेंगे, फिर हम गाइड कर पाएंगे कि क्या प्रॉब्लम है और हम आपको क्या हेल्प कर सकते हैं. So anxiety Lohan is saying anxiety and fear. So we have seen in certain communication disorder there will be anxiety and fear apart from communication disorders. Sometimes those fears are the result of the communication problem. So please call us. We will be doing perceptual evaluation और उसके बाद हम आपको guide कर पाएंगे. And राम ससाने लिखते हैं सर वॉइस की प्रॉब्लम मुझे भी है. तो राम ससाने जी आप हमें कॉल कीजिए और फिर आपकी प्रॉब्लम को सुनेंगे, समझेंगे, फिर अकॉर्डिंगली गाइड कर पाएंगे. निशा कुमारी लिखती है मेरा ब्रदर 7 इयर्स का है, फुल बोल नहीं पाता है. तो थोड़ा इतना इन्फॉर्मेशन से हम समझ नहीं पा रहे हैं कि वो बिल्कुल ही नहीं बोल पाता है या अटकता है या प्रोनाउंसिएशन की प्रॉब्लम है. तो आप हमें कॉल करें, फिर हम समझ पाएंगे उसकी प्रॉब्लम को क्या एग्जैक्टली आप कहना चाह रही हैं और बच्चे को प्रॉब्लम क्या है. किस नेक्स्ट है राजीव खरेल लिखते हैं सर आई हैव एडक्शन गैप और हैबिचुअल डिस्फोनिया, आई वांट ट्रीटमेंट विद यू. तो राजीव खरेल प्लीज कॉल अस, विल डू द परसेप्चुअल एवल्यूशन एंड इफ यू हैव एनी मेडिकल रिपोर्ट शेयर विद अस, स्पेशली इफ यू हैव स्ट्रोबोस्कोपी फाइंडिंग्स और लारिंगोस्कोपी फाइंडिंग्स, एंड देन we will be able to guide you. And next is Utsav Ghosh saying I have Puberphonia, what should I do now, can I meet you sir. So sometimes patient will say that I have problem X. When we do assessment in our clinic we find Y problem. So for that reason I suggest patient to avoid to use the technical term. You may be right or you may be wrong, we don't know. So please call us, we'll do the perceptual evaluation, and if we need we suggest certain tests, and then we'll be able to comment about your problem, and then we'll be suggesting for the appointment. So we need to do first perceptual evaluation. And ईशान कुमारी पासवान लिखते हैं सर क्या अभी कॉल करूं आपको, प्लीज शेयर योर कॉन्टैक्ट डिटेल्स. सो आवर कॉन्टैक्ट डिटेल्स आर इन द डिस्क्रिप्शन ऑफ दिस वीडियो. तो हमारा जो कॉन्टैक्ट डिटेल है, अगर आप इस वीडियो के डिस्क्रिप्शन में जाएंगे तो कॉन्टैक्ट डिटेल मिलेगा. हमारा वेबसाइट पे क्लिक कीजिए रीच मी, तो आपको मिलेगा हमारा कॉन्टैक्ट नंबर, फिर गूगल मैप पे कहाँ पे क्लिनिक सिचुएटेड है, ईमेल आईडी, सारे डिटेल्स मिलेंगे. तो आप हमें कॉल कीजिए, फिर जो है हम गाइड कर पाएंगे निशा कुमारी. और जो हमारे क्लिनिक खुला रहता है वो 9:30 to 7 मंडे टू फ्राइडे, और जो है सैटरडे को 9:30 to 5:30. तो इस बीच में आप हमें कॉल कर सकते हैं. आज लाइव था तो मैं लेट हो गया हूँ, 7:22 हो रहा है, ये मेरे क्लिनिक बंद होने का टाइम है. तो आप कॉल कर सकते हैं. और thank you everyone for joining us and watching us, and please subscribe our YouTube channel and don't forget to watch प्रीतम पांजा's post treatment live. और इससे पहले कि हम इस लाइव को स्टॉप करें, मैं प्रीतम पांजा से रिक्वेस्ट करूंगा कि आप अपनी वॉइस को फिर से एक बार सुनाइए. व्हाट एग्जैक्टली प्रॉब्लम यू आर फेसिंग, फर्स्ट इंग्लिश में सुनाइए, फिर हिंदी में सुनाइए, फिर बंगाली में भी सुनाइए.
Hi, my name is Pritam Panja. I am suffering high pitch voice problem since my puberty time, and nowadays I speak like a feminine voice and high pitch voice, and तो जब मैं ट्रेन में और लाइक ऑनलाइन क्लास वगैरह करती हूँ तो दिक्कत आता है बोलने में।
बंगाली में सुनाइए अब क्या प्रॉब्लम है, क्यों आपने हमसे कांटेक्ट किया, कहाँ पे रहते हैं, सारा बताइए बंगाली में।
আমার নাম প্রীতম পাঁজা, আমি হাওড়ায় থাকি। আমার পিউবার্টির সময় থেকেই পাতলা আওয়াজে কথা বলার একটা প্রবণতা আছে এবং আমি পিউবার্টির সময় থেকেই মেইলি কণ্ঠে একটু কথা বলছি, তাই জন্য আমি সঞ্জয় স্যারের সাথে কন্ট্যাক্ট করি এবং উনি আমার এটি সারাবার চেষ্টা করবেন এবং তাই জন্যই স্যারের সাথে কথা বলি এবং অনলাইন ক্লাস করার সময় বা কোথাও পাবলিক জায়গায় বলার সময় খুবই প্রবলেম হয়।
ठीक है प्रीतम, आपने हमें सपोर्ट किया। मेरी जो मुहिम है, जो मेरी एफर्ट है कम्युनिकेशन डिसऑर्डर का अवेयरनेस क्रिएट करने का पूरी दुनिया में, उसमें आपने मेरा सपोर्ट किया, इसके लिए बहुत बहुत धन्यवाद। आई वांट टू थैंक यू प्रीतम पांजा फॉर सपोर्टिंग मी टू क्रिएट अवेयरनेस अबाउट द अवेलेबल ट्रीटमेंट ऑफ कम्युनिकेशन डिसऑर्डर्स बाय नॉन सर्जिकल मेथड, by speech pathologist or by voice therapy technique. So thank you so much, and thank you all for joining us and watching us. Thank you all, love you all. And if you have any question for which I was not able to answer during this live, please comment, write in the comment box. We'll try to give answer in the next live. Thank you all, love you all.